All right, now that we got that recording started, welcome everyone. Good afternoon, and thank you for joining us today. Welcome to our first Falls Free Friday webinar of 2024. My name is Megan Passano, and I work for the Georgia Department of Public Health Injury Prevention Program, and I will be facilitating our session for today. So to start, I would like to go over a few housekeeping items with you all. This presentation is being recorded and will be available via the Injury Prevention Research Center at Emory's YouTube webpage in a few weeks. To reduce background noise, we do ask that participants keep themselves on mute for the first portion of the session. You are welcome to unmute at the very end to ask questions during our Q&A portion. We also have a chat box available, so if you have questions, throughout the session, please stick them in the chat and we will get them over to the panelists at the end for us to answer. If we don't have time to address all of the questions, we will be sure to answer them to you. There will be an email contact at the end of the presentation for you all to follow up with if needed. We would like to thank the entire Fall Prevention Task Force for their dedication and expertise in bringing this virtual session to you today. Here is our agenda for today. We will go over a brief update from 4 panelists, and we will discuss community-based fall prevention, faith-based fall prevention, and state-level fall prevention. So this session today, we will discuss how to host a fall prevention event, and I would like to start by introducing our panel speakers for today. Our first panelist I'd like to introduce is Miss Elizabeth Head. Ms. Head's area of expertise is aging and injury prevention. She earned her master's degree in public health from the Georgia State University and has worked in public health for 17 years. As the Deputy Director of the Injury Prevention Program at the Georgia Department of Public Health, Liz coordinates the BSEAM project for Georgia funded by the CDC. This project aims to incorporate public health into dementia, including Alzheimer's work happening across the state. In addition, she manages highway safety grant staff and injury prevention program staff working on projects across the lifespan. In her free time, she likes to spend quality time with her family. Our second panelist is Senior Pastor Allison Perlee. Reverend Allison Perlee was born and raised in Marietta, Georgia, and attended the University of Georgia Presbyterian School of Christian Education and Columbia Theological Seminary. She has been in ministry in the Presbyterian Church her entire life, serving at the Friendship Presbyterian in Athens, Overbrook Presbyterian in Richmond, Virginia, Decatur Presbyterian Church, First Presbyterian Church of Atlanta, and now Westminster Presbyterian Church. Allison's strengths are in pastoral ministry, in ministry to youth and young adults, as well as in parish ministry. She is deeply committed to global mission and has served in Honduras since 1990. She participated with the first faith-based fall prevention event back in 2019, and Westminster Church received a recognition award for this event. Refit fitness and anything outdoors is her passion. She loves contemporary music and cooking. Allison and her husband Phil live in Decatur, Georgia, and they have 2 adult daughters, Claire and Laura. Our third panelist for today is Ms. Sharon Nieb. Sharon has a PhD in educational leadership and has a master's degree in social work. She has over 30 years of experience in healthcare, public health, and academia. While serving as an executive director at Mercer University, she led the development of the first general physician assistant cardiac critical care fellowship in the country, which resulted in Piedmont Healthcare attracting a more diverse talent and strengthening their cardiology programs. From 2015 to 2022, she served as the program director of the Injury Prevention Research Center at Emory and is now currently serving as the Emergency Medicine Department liaison for appointments, promotions, and tenure with the School of Medicine, coordinating and supporting all emergency medicine faculty, appointments, and promotions. While serving as the program director for the Emory Injury Prevention Research Center, she has led the development and implementation of the first faith-based Fall Prevention Awareness Day in Georgia. Our last panelist for today is Ms. Rebecca Davis. Rebecca is a high school junior that conducts research on fall prevention. At At her church, she co-coordinated a fall prevention day at her church designed to help educate seniors about their fall risk. She has also conducted a survey correlating fear of falling and actual fall risk. Currently, she is focusing on a new project looking at the possible correlation between CAM use and fall risk by veterans. When not researching or doing schoolwork, Rebecca enjoys dance and is a competitive, award-winning speaker and debater. So without further ado, I would like to pass it on to our very first panelist, Liz Head.
Good afternoon, everyone. Thanks so much for the introduction, Megan. Really appreciative of all of our partners that can be on the line today. Next slide. I think that our partnership depth and breadth in Georgia can probably be described by a really awesome plate of spaghetti. Hopefully you've had lunch today and this doesn't make you hungry. But if you even just look at the panel that we have today, we encourage workforce development from a very early age and are often stunned by the depth and breadth of their talent. As you will hear from Miss Rebecca in a little while, we are guided by the wisdom and expertise of folks from all sorts of disciplines, with Reverend Allison being on the call and with Dr. Sharon Nieb being on the call. And that's really the case for the entirety of Georgia. We look to those folks that are maybe the non-traditional partners to guide us in the work that's done, and the results have been spectacular. So above everything else we're going to say in this call today, look to the people that you have already and that you know, and you're going to be surprised at the depth and breadth of wisdom that they bring to any situation, whether it's a fall prevention awareness day event or some other type of event. Next slide. So how are we doing the work here in Georgia? We have enjoyed a statewide, state-level fall prevention coalition for close to 30 years here in the state of Georgia, and that is a statewide coalition. As with all coalitions, the number of people on the roster versus the number of people in the meetings has waxed and waned over the course of years, but we are always looking to bring new folks in and are always pleasantly surprised when we update the books and somebody who we haven't seen in a long time falls off, and then they email us saying, but wait, I used the notes to inform the work I'm doing. So, you know, be confident when you send out those notes from your coalitions if you have them. Folks really do read them and peruse them and take inspiration from them, which is really, really cool. But our particular fall prevention coalition, being statewide, has been for two purposes. One, Georgia is a 159 county decentralized state. So we've got a lot of amazing work happening in the different regions of our state and don't always have a sense of what's happening. We are largely a rural census tract state. So being as rural as we are, what works in rural Georgia is very, very different from what works in metro Atlanta. And we have to be aware of that in all things. So beyond the sort of obvious networking and, hey, what are you doing? And gosh, how did you reach this particularly tough group? We have also done annual Fall Prevention Awareness Day events for about half to 3/4 of the time that we've been in existence. Now, those events started at our state capitol in a building really close to the state capitol, and it was about handing out information and networking of professionals. And then whoever happened to be downtown that day who wanted to go to the little store in the building, and that was fine. That's still a good audience to have. But as a group, we realize that your traditional health fair does not necessarily yield the types of behavior change that you might want to see. And so we began basing our events off of something called a Spark event. Now, if right now you were to Google Spark, you'd get all sorts of stuff around PE and children. And you would also get some things about social determinants of health. It's not really any of those things. It is really about taking an evidence-based approach. And so doing flu shots, doing any type of risk screening that you can do with a group of people that's not terribly invasive. So they do flu shots. They might do other types of screenings for risk. They might do a mammogram, things that could technically be portable, maybe look at bone density, though we know the science on that with portable machines isn't great. And so what we decided to do is to make our Fall Prevention Awareness Day events Spark-like. And in that, we would be focusing not on the handing out of materials you might not read or keychains you're going to toss eventually, although those things are nice, but more so on the screening and assessment piece. And so any Fall Prevention Awareness Day event that you see here in Georgia has an emphasis on screening. We do falls risk screens, as evidenced by the 3 types of screenings you can do in the CDC STEADY Toolkit, which stands for Stopping Elderly Accidents, Deaths, and Injuries. We do vision screenings, hearing screenings, blood sugar screenings. We also do demonstrations of Tai Chi, Tango. We bring in folks that use technology from our technology group, and they show people how to use technology to help them. And then we talk to folks about how it is that seeing a podiatrist could address your risk of a fall, or why on earth does my blood sugar have anything to do with my risk of a fall? People don't know those things. So in bringing those types of screenings into the event, it really changes the dynamic and allows people to maybe then have conversations with their physicians. We did this long enough that we decided it was important to create a fall prevention toolkit, which is super, super exciting, and has been successful enough that not only do we have a general fall prevention toolkit, we also have a toolkit specific to faith-based communities, because how you organize an event when you're coming out of a church perspective is a little bit different. The tenets are mostly the same, but how you do that is a little bit different within that, frankly, volunteer-rich environment, even though everybody's really busy. Next slide. No matter what type of event or toolkit that we've used, there are a couple of common things that I would like for everybody on the call today to listen for, that our other speakers will do a much better job of talking to you about than I could. 1, connect with your local public libraries as a partner. They're stunning. They're amazing. If your local library winds up being the physical space for an event and they have space to talk to people about 2 things, you've had a successful event. You're going to hear from our folks today that they had many, many vendors, and those are amazing events, but 2 vendors could be just as successful as 20 vendors. It just depends on what your capacity is. Use your existing partners. We had existing partners in music therapy, and when you read the science behind actual music therapy, you realize the benefit, and it makes people happy, which makes an event very fun. You want to schedule your events and your vendors well in advance. Almost make your event around the availability of your vendors where possible, particularly on larger events. Start small and stay simple. That is, when you get overwhelmed with how many things you could be doing, come back to starting small and staying simple. And before I turn it over to Allison, I will say the most important thing is, if you're having food, you need a cookie czar, because they will take all the cookies in their little hands and take them home with them. And I say that facetiously, but it is very true across all events. I'm going to let Allison talk to you now about the faith-based events.
Thank you so much, Megan and Liz, for inviting me to participate in this important Fall Free Friday webinar on hosting a fall prevention event. It really and truly has been a joy working with both of you and with the Injury Prevention Coalition and the Georgia Department of Public Health. I'm grateful also to Sharon and Liz, primarily for opening my eyes to the importance of education about fall prevention. Once I understood the seriousness of falls in older adults, I was eager for our church to host a community event. You could go ahead and change the slide, Megan. Westminster Presbyterian Church is a 300-member mainline congregation that has been involved in the community in a lot of ways for the past 46 years. We're composed of mainly older adults, and we jumped at the chance for our church to host a fall prevention event. And Westminster has now hosted 2 fall prevention events, one in 2019, as Megan said, and one this year in 2024. We were honored to receive the Injury Prevention Advocacy Award from the Georgia Trauma Commission for being the first faith-based organization to host such an event. This year on April 24th, our event, I think, was a huge success. We increased our attendance from 2019 with about 150 people to 248 this year. And you can see from the slide that we had 227 participants and 21 vendors with a total of 248 people. Signage was key, and we had welcome signs like this all over the church. We had directional signs. We even had volunteers to direct traffic. The event was held on a Friday afternoon in mid-April. Vendors and volunteers were invited to arrive at 9 a.m. and participants at 10 a.m. But in their excitement, several senior centers arrived early, even before our vendors arrived. So we regrouped and invited them to sit in the sanctuary and wait for preparations to be made. So we set up our entire church building for the event. We do have a preschool, but we were able to direct traffic away from that facility. We had parking lot greeters, hall monitors, travel guides, food volunteers, and floaters to help us organize and facilitate the large expected crowd. We had church member volunteers who were professionals and led some of our classes. We had nurses, physical therapists, occupational therapists, pharmacists. There were organizations such as the Northside Concussion Institute, Senior Provisions, and our own Calvin Cove Adult Respite Care Ministry, who set up informational tables in the halls for displays and conversation. We were happy to have 21 vendors, and those included screenings like blood pressure, O2 screenings, balance screenings, strength testing, as well as medication consultations. We had classes such as a bingo size, music therapy. The fire department and the police department talked about home safety, and we had a refit balance exercise class, which I taught. It was fun. We had several of our workshops had informational material, booklets and flyers that were handed out. And during registration, our participants were given a tote bag, which advertised Westminster Presbyterian. We couldn't take the chance not to do that. And inside we had coupons and giveaways, as well as flyers and these booklets. And so, for example, in the refit class, we had a flyer that told the community when our refit classes are offered 3 times a week in our church, and they could join us. But this bag also included an evaluation form that we encouraged people to fill out. At the bottom was a name tag tear-off for a drawing for a lovely homemade, handmade quilt that was designed and created by our own Westminster deacons. So that was fun, and that encouraged people to fill out the evaluation. So we felt our event was extremely successful, and we learned lots from it. It was and seemed to be well received, that our event was a hands-on event. It was not just a fair where people came and received information. There were numerous opportunities to talk to professionals. People enjoyed the tote bags, and we offered a free lunch, which included a sub sandwich, chips, cookies, and a bottle of water. This necessitated, though, that people pre-register either on Eventbrite, through their senior center, or by phoning our church office. We circulated flyers to organizations and agencies, to senior citizens. We put it on Facebook and on our church website and on our marquee. And the flyer had a link to sign up to Eventbrite. Some of the challenges that we faced included recruiting and training enough volunteers for an event this large. The cost of such an event, the cost of our 2024 event was approximately $1,200, but we did offer a free lunch. Parking, even though we have a large parking lot, it filled up quickly. Marketing and advertising are challenges that we face. Setup and cleanup. We used our entire building, so there was a lot of setting up of tables and chairs for different vendors. And then we had to clean up after the event so that we would be ready for Sunday morning. So we did learn a lot of lessons from the event. It's a lot of work and it requires a lot of pre-planning. So to begin at least a year out, recruiting a committee and volunteers and beginning to line up vendors. We think doing this event every 2 to 3 years is best. It would be way too much to do it annually. Funding needs to be considered either through fundraising, community grants, or budgeting in the organization's annual budget, or possibly asking for an entry fee, which we really did not want to do. We think that giveaways are important, and we wanted to plan for that. So we went to local vendors and asked for coupons for free ice cream, etc., and for the free lunch. We did learn that scheduling lunch earlier is important. We started our lunch at 11:30, but next time we would start it at 11, and we did 30-minute shifts because we could not seat all of those people at one time, but people loved free lunch. And then marketing and advertising is important. We had a flyer that we circulated, as I said before, and we also emailed it out to a number of organizations, and we put it on our marquee, as I said. So it was a wonderful opportunity, I think, to partner with Injury Prevention Coalition and the Georgia Department of Public Health. It was a delightful event, and we will do it again. And we encourage you to seriously consider providing a fall prevention event for your community. And so I'm going to turn this over to Sharon, who will give you even more details. She's a church member here. Thank you.
Yes, thank you, Allison, for that. I am a church member, and I also am a deacon and an elder in the church. And I found this when we began as a real challenge. And I think that after doing it 2 times, we have learned, I think, the best way that we can do this and make it successful. One of the things I wanted to mention that was imperative for us was to form a falls prevention committee within our church. This really helped us to be able to make this event successful. The committee had, I'd say if you were going to form a committee, if you could have maybe, if you're a small church and it's a smaller event, probably 5 to 6 people, but we did have 10 to 12 people from time to time on this committee. Our focus areas were definitely registration, getting volunteers, food, that was a big one, marketing, and vendors. And marketing too is imperative for the success of this event, because we found that contacting our senior centers was really imperative to the success of the event and our attendance. And the committee also supported our planning and our cleanup and training our volunteers. Also, we had an evaluation, and we think evaluation of the events are important. I believe that if you're going to do an event, getting at least a survey from the participants about what they enjoyed, but also what was most useful to them. As Allison mentioned, we had 227 attendees. 95 completed the evaluation, which was about a 40% return rate, which was great. She also mentioned that we had a drawing for a quilt, a beautiful church quilt. Our evaluation scoring used the 1 to 4 Likert scale, saying strongly disagree, disagree, agree, and strongly agree. And the next slide will show you some of the results of this. For the 4 questions that we had, Recommending to a friend, feeling better about their ability to reduce falls. Was the education useful and use in their everyday life? We had a score of between about 3.7 to 3.9, which is extremely high. And so we were very pleased about how our participants felt about this event. Next slide. Also, we had class activities. We had them ask about that. We asked about that. Over 50% of the responses said they were interested in continuing a class. Also, hearing about the event, vast majority of responses were through their local senior centers. And then we had the vendors most enjoyed and most useful. One of the vendors that I want to point out here, as Liz was saying before, if you have 1 or 2 anchor vendors, you can have a successful event. Mercer's University's physical therapy department came, brought 4 community PTs, and they did the steady balance screening, which is so important. We know CDC has recommended that screening, and they did that. And it was very important to our event. Vendors to add, hearing, vision, we got podiatry, memory screen as a vendor to add. I thought was very important. Also mental health, I think is an important one. So evaluation and our feedback, we found this information very useful to us. Here's what we know. Our steady balance screening also produced referrals to local PTs, and also our attendees were given exercises to do if they needed to improve on their balance. Primary care provider referrals were given by our nurses who were doing our blood pressure checks. They found several people had high blood pressure that were not currently taking medication, and they referred them to their primary care provider. Safety education. This came from our fire and police department. It was very important to know about loose banisters, rugs that were in the living room that needed to be pulled up, fire extinguishers that hadn't been checked in years. All of this very important. And of course, medication counseling. When you do medication counseling, they were learning about interactions between the drugs that they were taking. Also, how to take their medication so that they don't have an accidental overdose. Our committee felt that this was a great outreach to our community. We also found that our participants felt less isolated. They enjoyed the ability to make friends. And we know when people feel isolated, they get depressed. And when they get depressed, they are more likely to fall. Lines were too long. We did get that comment, and we believe that that did occur at certain times with some of our vendors. And but we did our best to make sure that people got through and the education was useful to them. Next slide. Another important piece of this is that the faith-based falls prevention toolkit, which was developed in partnership with DPH and iPrice Falls Prevention Task Force, has a 6-month plan and implementation steps, and that it does utilize evidence-based interventions. We use this resource to develop our evaluation survey and to follow the steps that were recommended. I do think that getting your senior centers in place early, finding out what newsletters that they have or other materials that they may have that they can advertise this in is really imperative. We got probably about 66%, I believe 60 to 70% of our people that were registered through this. We do know too that probably about 2/3 of the people that came were not church members. They were from the community. So this was important to us, and it was important to our mission to reach out to our community. And I want to turn this over next to Rebecca Davis. Rebecca, welcome.
Hi, my name is Rebecca Davis, and I co-hosted a Falls Prevention Day with my church last fall. Overall, we did have 73 people from 4 counties all across North Georgia. One of the biggest attractions was that we did have 7 vendors, including 3 universities, government agencies, and private businesses. In addition, 2 faculty members from 2 other colleges were at the event sharing their expertise in 2 more healthcare disciplines. Next slide. We had a physical therapist, nurses, chiropractors, a firewoman, Cobb County Senior Services, and an occupational therapist all there to give free screenings. The college students from those universities worked with the nurses, chiropractors, and physical therapists. Next slide. Unlike the event at Westminster Presbyterian, we did not have any trouble getting volunteers. We actually had to turn some away because we had filled all the needed spots and we had a full backup squad. The volunteers helped participants to get to all the stations and got to chat with them while they were waiting in line. The excess amount of volunteers could be in part due to the fact I am highly active in my church and seniors want to help a young high schooler. One thing the volunteers mentioned they enjoyed was that they got to go through the fair itself before it opened to participants, kind of as a test run to see which things worked best. This gave the participants something to talk to for the volunteers that they could chat with and waiting in line, such as which vendors they liked most or which ones they found most beneficial. One of the things we needed, such as it was in advertising, we desperately needed more advertising. It was one of our hardest challenges. This could be a part due to the short times between the church approval of the event and the time the church actually held the event. We needed a larger budget for advertising and a longer time to advertise. Next slide. It was great to have so many college students here. It really made the event intergenerational. The senior citizens enjoyed seeing so many students passionate about helping them. It also gave the church a chance to reach out to multiple areas at one event. The college ministry was also there chatting with the students, even though they were part of the vendors. The students enjoyed that. They thought they were coming to help in the community, but they got to be helped as well. Many college students were begging to practice or gain volunteer experience, and they got to do this before they went out into the workforce. The colleges want to get their names out into the communities as well, so it was a win-win for both the college and the churches. However, college schedules do run differently, so be prepared to offer events at different times or dates. For example, the nursing students and the physical therapy students had only started their school year 3 weeks before my event was held. Thus, the first year students couldn't come, and we had to work about the second year students when they could come. It's also important to mention that we did have research conducted at the Falls Prevention Day itself. It was great because it meant that there was a lot of seniors in one space and time. Lots of seniors to take the survey at one isolated moment. However, the nurses, my biggest challenge, I think, for the particular vendors was that we needed to have blood pressure cuffs in all different sizes. That made it difficult to get all the different screenings at an accurate measure. I think I'm going to turn it back over to Miss Megan.
Thank you to all of our speakers for sharing your experience and your expertise with us today. We would like to open the floor up to participants at this point to ask questions to the panelists on the call. They're happy to kind of answer those questions and expand on kind of topics that you're most interested in. One thing I did forget to get you guys to do beforehand was if you guys could complete this poll here on if your organization has or plans to host a fall prevention event in the future. This will kind of help us gauge our discussion for this afternoon. Almost at everyone. I'll give it another minute or so. All right. Thank you all for completing that for us today. So then I will go back to our presentation here. And we will open the floor for participants to ask questions to the panelists. You are welcome to do that in the chat or unmute yourself and ask over your video. While you guys are thinking of some questions, I will get us started with a question for the panelists to get the ball rolling a little bit. So one question that came up before our presentation today is many of the panelists spoke on the events and spoke that it wasn't feasible to do it every year and that they would prefer to do it every other year, potentially every 2 years. So what role, if any, could organizations play in maintaining some falls prevention support? So helping you keep these events yearly, what kind of additional partnerships or funding would be needed for you all to do that yearly? And this is open to any of you, so whichever kind of event works best. We'll start with you.
I think having a class, not just one single specific event every year, would be really great, because specific events need to take lots of planning, but classes, as soon as you have the class plan, those can be repeated time and time again. So I think having a class 2 or 3 times a week, I know Westminster Presbyterian does have that refit class, and that is greatly beneficial. So I think that would be one of the biggest things, because holding a large community event is very hard to do frequently.
And I think too, Rebecca, you're right. And I also think that even just bringing it up in the newsletter, in Sunday school classes, I know recently, for example, just, rubber meets the road kind of thing, is we had some welcome mats that people walked into the church, and one of the lips was coming up on the side of it. And we ended up having to buy a new welcome mat so that wouldn't be a fall risk or a trip risk. We also, one other thing I didn't say about our event was that we chose not to host another fall prevention event, not just because of COVID, but because our parking lot was in really bad disrepair. And we worried about seniors coming here to the church building when the parking lot was in disrepair. So we waited until we repaved our parking lot. And so things like that, but just bringing those up in conversation with our session, which is our board of directors of the church, having conversations about fall prevention, I think is another way to keep it fresh.
Yes, I would add to what Allison said. In fact, some of us in the church were actually victim of falls, and including me
and me
and our pastor. And I think that brought the issue forward. And I think that it is continuing to be a point of discussion in our Sunday school classes at times, and in some of our social events, and just keeping that in mind. And also looking, as Allison said, for things that at our church may be a fall risk is another way to do that. In order to do it yearly, I think a larger congregation might be able to handle that than ours, but it does at times can cause volunteer burnout if you, because our church does a lot of community work. And so we have a lot of things going on. And so these volunteers are involved in multiple things. So we have to take it a little slower because of that.
And I know, I'm sorry to jump right in real quick, but before you start answering these in the chat, one thought that occurred to me, which we have done with the Methodists and the Baptists who are right next to us, is maybe partnering with some other faith-based organizations and doing it annually, but switching venues, for example. I don't know, just a thought.
Mm-hmm.
Thank you for that. Our first question from the chat, it came directly to me, but I will share it to the group. So how would participants on the call get access to that toolkit? So this one, I think, Sharon, that would be more specifically to you, if that's a public document, if we are able to share it.
It would be for me and Jill, and because Jill is currently director, but yes, that document is, we can share that with anyone who would like to have it. We can share it with all the participants on this call. Jill, do you concur?
She
Yes.
said yes.
Happy to share.
Mhm. Thank you, Sharon. Our second question I see here is, how did you target your marketing? Were you mostly focused on social media and word of mouth, or did you reach out directly to senior centers or area agencies on aging?
I'll start. We did a personal reach out to each of the senior centers. I think that is the best way, because senior centers are busy. So if you leave flyers, that works. But I personally called the director of each senior center and established a relationship with them. And all of them concurred and were very interested in the event, and actually signed up multiple people on our Eventbrite registration. In fact, the senior center closest to the church had over 50 people coming. So it was very important for us to develop a personal relationship. I just think that works the best.
I agree. I firmly believe word of mouth or reaching out to the senior centers, area aging centers on aging was the best way. We did post it on my church's social media, and we found out almost promptly that the senior citizens don't use social media, and if they do, they used Facebook, and it was hard to work on signing up through Facebook. There were several technical issues with that. So we gave essentially up social media, trying to focus on marketing. We did that through word of mouth. We put flyers at the senior centers and area agencies on aging. I mentioned in my speech that Cobb County Senior Services did partner with us, and that was hugely beneficial because they have a large number of classes, and they were able to spread flyers to the seniors directly in those classes, which was hugely beneficial for us. I also did a podcast at a nearby senior center, which the senior centers were hugely involved in that podcast. So it made it easy for me. I recorded a video and sent it in. It wasn't too much directly on me driving to all sorts of senior citizens passing out flyers. It was a single video I could do in my own home.
That's a great idea.
Thank you for that. Rebecca, our third question is specifically for you. So how did the successful implementation of your faith-based fall prevention event impact your career trajectory as you continue your education?
I think overall it helped my education and my career trajectory. I really got to enjoy and really got to work with these colleges and see which colleges would I enjoy going to. I was thinking about going into the medical field, and I was enjoying, okay, this is interesting. This is maybe what I would want to go into. I enjoy getting to network and work with all these different businesses and government agencies and universities and getting to put this out for the community. I'm really passionate about serving the community. So I believe it really helped me in continuing my education, not just in the college years, but further beyond the college years when I'm in the workforce.
Great, thank you for that. I know it's an exciting opportunity, and we loved it at our level to have a high school student that's as involved and as interested in this topic. So it's awesome to get some feedback and kind of background with somebody your age and kind of your population as well. So I don't see additional questions in the chat, but I can give you one more just to kind of end unless somebody else has something else to ask. But the last one I will ask for today is, what was the most popular or most liked demonstration at your event by participants or attendees at the event?
I'll start. I think our classes, bingo size and refit, were packed. And I think they, Allison, I don't know, I think you had, what was it, 100 and some people that went through yours? And also our Mercer University Physical Therapy. That one is the anchor vendor You really need that. And so, you know, we probably would have worked around their schedule in order to make sure that they were present. I think that's really important. But our classes were highly, highly popular. Our fire department, and we had people say all. So they really enjoyed all of them.
Well, we also, I think people really enjoyed the classes for sure, but we also had our organist playing piano music during lunch, and people really enjoyed going in there if they needed to rest, or if a line was too long, they would go in there and they would listen to the piano and visit and rest and have some water or lunch. And so that was good. Yeah.
Even though I was talking about volunteer burnout, we had about 30 volunteers for this. So we had a good number of volunteers, but you know, it does take quite a bit of time.
I think for me, it would probably have to be a tie between the physical therapist students and the Cobb County Senior Services. I really enjoyed getting to see, and I know the senior citizens did too. This physical therapists gave a really in-depth balance screening, walking screening, maneuvering obstacles on the floor screening. That was really beneficial, and they seemed to enjoy that. They brought rugs, stuff that you would have in your home. And the Cobb County Senior Services, the senior citizens enjoyed getting to see all these different objects that you could help with stuff in your home. For example, they brought a answering machine that was designed for senior citizens, and they also brought different rechargers to help you in case you couldn't quite get that plug into the edge of your phone. You just laid it on there. It's different types of things like that. Reminders to help you take your pills. They really enjoyed getting to see all that technology to help them remind. And they also told them where they could get this. Oh, this can be bought at Walmart. This can be bought on Amazon. That the senior citizens really enjoyed getting to see how they could take this knowledge into their own home using that technology.
Thank you. It does look like, since we have a few more minutes, there is one more question in the chat. I will keep this as the last one to keep everyone on track for today. But the last question for you all is, what exactly did the physical therapy vendor do at the event? I know, Rebecca, you just touched on it briefly, but if Allison and Sharon, if you have anything else to expand on that.
Well, I actually, and Allison did too, I went through the screening. So I can tell you, they have you sit to stand. They have you walk in a straight line back and forth. And they also have you stand and try to stand on one foot. It is exactly what CDC has recommended as far as balance screening. And then when they give you your results, they tell you whether you are at the average for your age group, if you're better than average, or if you're below average. And if you're below average, what exercises might you need to do? Or is it something that you may need to get physical therapy referral for? And so I think that was very important. It was quite thorough. Allison, did you want to add anything to that?
No,
Did you pass?
I passed. I did do the screening with David Taylor and the physical therapist. I know that Piedmont Physical Therapy was across the hall from where I was teaching refit. And they seem to be doing a lot of conversations. I'm not sure what those included, but I was pretty much in my refit room and cave the whole time. So I never really got out to see exactly what the physical therapists were doing. Our occupational therapist, which I thought was really interesting though, did do a strength testing where you squeezed some things and she could measure your strength, and talked about some exercises to do to increase your strength and stuff like that. So I thought that was interesting, but otherwise I was busy doing balance exercises with refit.
All right, so we are nearing the end of our time today. I would like to thank all the panelists for sharing their experience and expertise with all of us today. I would also like to thank all of our attendees for joining us on a Friday afternoon and asking some great questions to our panelists. As a reminder, the session will be recorded and available on the Injury Prevention Research Center at Emory's YouTube channel in the coming weeks. If you are registered, I will get an email sent out to you as a reminder that it is available for you. If you do have additional questions for our panel members or would like to share details of an event you or your organization is hosting for Fall Prevention Awareness Month this fall in September, please don't hesitate to reach out to myself and I can trickle down to the panelists today. My email is on the screen for you here. And lastly, there will be a brief survey at the end of this webinar with a few questions for you. If you have a moment, it's only 5 questions. Please complete this for us. We appreciate your feedback so we can keep these sessions going. We hope to see you all later this fall for the Fall Prevention Awareness Month, for additional Falls Free Friday events. And again, I would like to thank our panelists and our participants who joined us today. Thank you for spending your Friday afternoon with us, and I hope you all have a great weekend. Bye, everyone.
Thanks,
For
Megan.
everyone, do you want to cover DeAndre's question?
We don't have to later on with one of the task forces or something like that too. So if we have time, yes, but if not, then that's fine.
That's right.
Well, I can go ahead real quickly and just say that, DeAndre, that the medication interaction is not widely known. And we do think it's very imperative because there are a lot of people coming into the emergency room, especially older adults, that have fallen have fallen because of dizziness and passing out. So it is something that needs to be addressed with the pharmacist.
And also, I think, Sharon, if you'll remember, we had a lot more people who wanted to have an opportunity to talk to a pharmacist about medication interactions. I mean, you know, if you're not taking your blood pressure medicine correctly, then you might have low blood pressure, which causes, you know, you to fall as well. So I feel like we would try to have another pharmacist next time we do it, because it seemed like that was very, people wanted that.
Yes, and the pharmacist, I went through it. And I think it's important. I think it's very important in preventing falls.
Thank you.
Thank you.
Thanks, DeAndre.
Yes, thank you, Allison and Sharon, for answering that last quick question. Again, thank you all for being here and joining us for this Friday afternoon. Hope you all have a great weekend, and we hope to see you later this fall for Fall Prevention Awareness Month. Bye, everyone.
Bye-bye.
Bye. Thank you.